Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D. Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D. Wilson.
This is Pamela D. Wilson, caregiving expert. I'm your host. You're listening to the Caring Generation radio program, coming to you live from the BBM Global Network, Channel 100, and TuneIn Radio. The Caring Generation focuses on conversations about health, well-being, caring for ourselves and loved ones, all tied together with a little bit of humor and laughter that are essential to being a caregiver. Our topic for this evening is advocating for elderly in nursing homes, tips for avoiding elder abuse and neglect. Remember to take the Caring Generation with you wherever you go. Follow and listen to the show on Apple Podcasts, Google Podcasts, Pandora, iHeartRadio, Spotify, Spreaker, Stitcher, SoundCloud, CastBox, and more. Share the program with your parents and family members. You can download a podcast app to their cell phones and show them how to listen. It's the perfect way to help begin conversations about caregiving by letting me do the talking for you. This week, in talking about advocating for elderly parents in nursing homes and tips for avoiding elder abuse and neglect, we'll look at nursing homes from the perspective of common fears. Why elderly parents fear going to nursing homes. I'll share the most common types of elder abuse and neglect that happen and the importance of advocating for elderly in nursing homes. I'll also share information about nursing home regulations and how these rules complicate getting the care you want for elderly parents. My guest is Jim Berklan. He is executive editor of McKnight's Long-Term Care, McKnight's Assisted Living magazine, and McKnights.com. These are healthcare industry publications. Under his direction, McKnight's has been honored with more than 100 national journalism awards. He is a specialist in the field of seniors, housing, and care, and he works with many professional companies in the care industry. Jim will share information about Medicare's new program to pay nursing homes for patient care called PDPM. If you work in a nursing home or know someone who does, PDPM was implemented October 1st, 2019, and it's caused quite a stir. Separately, I want to send out condolences and celebration of an amazing life to the family of Kirk Douglas, the actor. He passed away today at the age of 103. What an amazing life. Let's start by talking about fears that elders may have about nursing homes. One of the things that my mother said to us repeatedly was, never ever put me in a nursing home. The physical appearance of nursing homes has changed a lot in the past 100 years. If any of you remember the movie One Flew Over the Cuckoo's Nest with Jack Nicholson, that movie showed the idea of a mental institution, which is more of what elders think of when they think of a nursing home. Our parents may have had a bad experience with their parents or another family member who suffered from elder abuse and neglect. There are so many concerns about mistreatment and having to live in an environment that feels more like an institution than a home. The range of people in nursing homes varies from persons who are there for short-term physical rehabilitation as a result of an injury like a hip fracture, to others who live in a nursing home permanently. Seeing others in poor physical or mental condition does result in worries and more health concerns about needing care. Parents worry about being more dependent and a greater likelihood of experiencing elder abuse and neglect. How many of you have visited a nursing home? The newer homes are less institutional looking, but based on my personal experience, it's not the way a nursing home looks, but the care that is provided that's important. This is one of the areas where I've seen adult children make so many mistakes. Be careful about choosing a nursing home that looks beautiful, but that may provide the worst care that does result in elder abuse and neglect. Advocating for elderly in nursing homes means that you are proactive. You want to learn how to get better care for elderly parents and learn how nursing homes work. Let's talk about the definition of elder abuse and neglect, and I'll give credit to the Toronto Declaration on Global Prevention of Elder Abuse. Elder abuse and neglect is lack of appropriate action in a relationship where there is an expectation of trust that causes harm, that is physical, psychological, emotional, financially or material motivated, sexual in nature, or neglectful. The definition focuses on the relationship with the person who is more likely a family member than anyone else who commits the elder abuse and neglect. Elder abuse and neglect can also be self-imposed by an older adult who doesn't take care of him or herself. In other cases, elder abuse and neglect happens outside of a family relationship and outside of the home. For example, in nursing homes. In a couple of weeks, we have a show coming up where we'll talk about elder abuse and neglect that is self-abuse, mostly happening in the home by elderly parents and what family members can do about it. Let's talk about nursing homes and the types of issues that result in elder abuse and neglect, and the need for advocating for elderly in nursing homes. There are 3 areas where issues happen. Community issues, I don't like using the word facility, so I say community. Resident issues, meaning issues caused by elderly parents or other residents in the nursing homes. And staff issues. Let's talk first about staff issues. In my opinion, and this is based on 20 years of experience, most of the staff issues result from a lack of training and support by supervisors. The care staff, they want to do a good job. Many of the staff who work in nursing homes and other care communities, they're not highly educated. They may have a CNA, which is a Certified Nursing Assistant license, but no other advanced education. The nurses and doctors are more highly educated. However, the staff taking care of your elders are CNAs and the other staff. This is where advocating for elderly in nursing homes becomes your responsibility. You must become more aware of the issues that can happen so that you can avoid them. Types of nursing home neglect that create the need for advocating for elderly in nursing homes are medical, basic needs, personal hygiene, and social or emotional neglect. We will continue the conversation about types of nursing home neglect in the second half of the program. Up next, we are going to be talking to Jim Berklan. He is the Executive Director of McKnight's Long-Term Care. He joins us to talk about Medicare's new program, which pays nursing homes for patient care. It's called PDPM. You can learn more about McKnight's at McKnights.com. Jim is going to share important information for elders, for caregivers, and for the staff who work in nursing homes about this Medicare program that really has changed the way that care is delivered to our elderly parents. It's kind of gone away from the old, what I call the physical therapy model, where you had to be in a nursing home for a physical need, you would receive care and treatment, and you had to make continual progress. The new program is focusing on a lot of different things that are very important for caregivers. Share the Caring Generation with friends and family members. You can follow this and all of our past programs on my website and read the transcripts at PamelaDWilson.com. Go to the Media tab, scroll down to the Caring Generation radio show. This is Pamela D. Wilson on the Caring Generation, live on the BBM Global Network, Channel 100, and TuneIn Radio. Stay with me. We'll be right back after this break.
Dr. RC will share extraordinary resources and services that promote educational success, as well as making a difference in the lives of all social workers, as well as the lives of children, adolescents, and teens of today. She will have open discussions addressing many of the issues that we face about our youth and how being employed in the uniquely skilled profession of social work for over 18 years has taught invaluable lessons through her personal experiences. She will also provide real-life facts, examples, and personal stories that will confirm that why serving as a child advocate is extremely beneficial when addressing the needs of the whole child. Listen live Saturdays, 10 a.m. Eastern on the BBM Global Network and TuneIn Radio as Dr. RC will provide thought-provoking information that will empower, encourage, and strengthen students, families, and communities across our nation. You can also visit her at soarwithkatie.com.
There are artists, and then there's Alice Asmar. This award-winning artist has spent her entire life devoted to her artistic pursuits and has had a lifelong fascination with American Indians of the southwestern United States. Her book, Dance to the Great Spirit, showcases her drawings and paintings inspired by sacred rituals of the Pueblo Indians, and 4 of her lithographs are in permanent collection at the National Museum of American History and the Smithsonian Institution in Washington, D.C. She is one of 4 artists in the United States to win a Woolley Fellowship for study in Paris at l'École des Beaux-Arts and has been featured in numerous publications. She's exhibited at the world's most prestigious museums and galleries and recently won a 20-year service award from the Burbank City Council and the inaugural art competition of the Foundation of the United States in Paris.
Visit www.asmarart.com, www.aliceasmarinternational.com, and email Alice at aliceasmar@aol.com.
This is Pamela D. Wilson, caregiving expert. I'm your host. You're listening to The Caring Generation, coming to you live from the BBM Global Network, Channel 100, and TuneIn Radio. We're back with Jim Berklan, executive editor of McKnight's Long-Term Care, McKnight's Senior Living, and McKnights.com. Jim is a specialist in the field of senior housing and care. Jim, thanks for joining us.
Thank you very much, Pamela. Glad to be here.
Medicare's new patient-driven payment model called PDPM, it appears to be decreasing the time for physical and occupational therapy services in skilled nursing communities. Is my understanding accurate of that?
Well, technically not yet. I can say that because certainly Centers for Medicare and Medicaid Services, regulators, everybody's keeping an eye on this. What's important to know about this is, as you indicated a little bit earlier in the segment, is that the emphasis has gone away from what do you need for therapy, this is how much you're going to get paid for an entire stay, to a broader nursing component. So what it's done is it's really taken the spotlight off of therapists and therapy and taken them a little bit off the pedestal. And so what we're seeing in conjunction with that is a little bit more group and concurrent therapy. So what you may have seen in the news, some of the listeners as well, is that some therapists have been peeled off. There's less work out there for them. So the provider groups are kind of combining those efforts. But it's too early to say that, hey, people aren't getting the therapy they need, because, of course, CMS is going to be monitoring that very closely.
And there was an old system, and I laugh at these acronyms, but the old system was called RUGS, and now it's PDPM. Is PDPM better for patient care?
Well, that can be a little bit of a loaded question because, again, there are so many things regulated that nobody's going to say, well, you didn't fit in the slot, you don't get taken care of. But by and large, yes. The people that I write for, the professionals out there, as I said, it serves a broader spectrum. What it does is it puts the nursing, they say, back in nursing homes, meaning that the nurses feel more involved. There's an integration of everything, whereas, it focuses more on clinical areas for the reimbursement. It's a more holistic look, if you will, and that way the provider companies are able to allocate their resources so that, as we'll talk a little bit coming up, is that, you're going to serve and you're going to get paid directly for, are you doing more swallowing studies? Are you doing more mood disorders, that type of thing? Whereas before, believe it or not, a lot of this was triggered in on how much physical OT therapy you needed.
And so it sounds like, I call it, this clinical care for non-professionals. It would be like managing a disease, correct? Or managing a diagnosis?
It's a little bit akin to the DRGs in hospitals, diagnostic resource groups or whatever. But this is, again, taking it a little bit broader. And I mean, this has been scored by industry panels and experts to say this is where some of the care should go. So sometimes I think there's a little suspicion, where are we going to get away with cheaper care and this or that? And we'll talk about that maybe a little bit later. But there are things still mandated. And where the enthusiasm comes is they say they're getting, quote unquote, paid for work that was, quote unquote, free before, because it had to be included, but it was just kind of like, take care of it, but it comes under this umbrella for this therapy segment that you're being paid for.
What are the main challenges that nursing homes are seeing in changing to this new system?
Well, a big one is that all of a sudden but they were advertised as they have to take account ICD-10 coding. And there are thousands of more options now to do this. And so they had their own coding systems, if you will. So this is coming more in line with hospitals. Now that opens up a lot of great opportunities because you can slice your diagnoses so many different ways. The other challenge is they really need to get these assessments right when a patient comes into a nursing home for the first time. There used to be a handful of different markers, 5-day, 7-day, different where you'd reassess. But now the real hullabaloo is, hey, we've got to get our MDS coordinators, the minimum data set. This is what assesses the patient when they come in, of course, and that sets the payment rate. Now there's only one intermediate range in there now, so that if you don't get it right at first, you could be leaving dollars per day on the table from the provider's point of view and really, kind of goofing yourself up. So what that needs then is more interdisciplinary help. You're really talking to your nursing staff. You're really talking to others to come in with their assessments and put this matrix, this jigsaw puzzle all together so that you start at an appropriate reimbursement rate. And like I say, not leaving your own payment on the table.
And is that, so I saw an opinion in the McKnights in November, and there was a quote from John O'Connor saying long-term care has a proven history of following the money. Is that kind of what you're talking about?
It really is, because after all, these are businesses, just like any healthcare provider. But the key with nursing homes, we have to remember, is Uncle Sam is the predominant payer. I mean, I was surprised when I came into this 19 years ago in this business, is that private insurance does not pay or even private funding very much. So Uncle Sam is calling the tune. And as you may know, very limiting, and the margins are very low. Medicaid, after all, pays for 3 out of every $5 or a little bit more of that of everything. So what John was talking about, he can be as wry as anybody is that where Uncle Sam is going to pay, that's where somebody who's working within this industry is going to kind of migrate a little bit. Now, we don't think, we'll talk about it maybe a little bit more later, but PDPM doesn't look like it's going to be overdrawing its own bank account like happened in 2011, 2012, when this resource utilization groups was introduced.
And we've got about a minute left. You mentioned that the assessment has to be done right away, and there were evaluations. Are the evaluations every week now? Because it used to be like, my clients would get evaluated every week to see if they would stay another week.
Well, under certain diagnoses and certain conditions, yes. However, if we're talking toward more of a long-term stay in nursing home, you're getting that initial assessment, and that's what you're in for. Of course, that will be modified, but then under this new system, the payments dwindle very quickly under many diagnoses. So it behooves the provider to get it right, and then you'll be, dribbling off real quickly. Now, speech-language pathology is an exception to that, so it's something people are really keeping an eye on, where the utilization patterns are with that, and I'm sure we'll want to talk about that a little bit more later.
We will. We are going to continue our conversation with Jim Berklan of McKnight's about Medicare, nursing homes, and PDPM after this break. I'm Pamela D. Wilson, your host. You're listening live on the BBM Global Network, Channel 100, and TuneIn Radio. Stay with me. We'll be right back after this break.
Tune into It's All About You with host Dr. Martha Latz, a lively weekly broadcast on BBM Global Network, one of the most empowering shows for time-starved, overscheduled multitaskers. The professional expertise of Dr. Latz is directly available live every Thursday at 1 p.m. to answer and address concerns about relationships, life transitions of career, meeting, dating, and committed relationships. It's All About You with Dr. Latz will expand your understanding of current concerns across your relationships by broadening and expanding possible solutions in developing skills for mutually desired outcomes. Dr. Martha's expertise is as a licensed marriage and family therapist, life, transition coach, and all things to do with communication at work, home, and with friends. Check out her website at auniquetherapycenter.com.
The earliest human societies worshipped a female goddess. Little is known about this time because we did not always have a written recorded history. It was around 3100 BC when the Sumerians invented the first written language, and everything that preceded this time is prehistory. The prehistorical record includes all of women's unwritten history from 30,000 BC to the time that men began achieving political power around 3000 BC. Male feminist artist Kimberly Berg maintains a strong position in educating and inspiring both men and women through his devotional art to the goddess in all women. Studying their history is paramount to understanding who women were and who they would become later living in a patriarchal society. To learn more about this important time in our history, go to www.isisrising.net.
This is Pamela D. Wilson, caregiving expert. I'm your host. You're listening to the Caring Generation radio program for caregivers and aging adults, coming to you live from the BBM Global Network, Channel 100 and TuneIn Radio. Let's continue our conversation with Jim Berklan of McKnight's. Jim, during the break, we were kind of talking about how skilled nursing facilities get paid, therapy versus other services. Can you talk about that and just the guidelines of CMS making sure that people get good care?
Sure. Under this new PDPM system, it spreads it out a little bit more. We go into more interdisciplinary care, as I mentioned earlier, taking in more segments and more sections of the caregiving staff. One of the things it talks about is that the providers like it that they're getting paid for non-therapy services that, they've always delivered, so to speak, right? And they've always provided these services. But, some examples of the services that they're receiving, increased payment under PDPM include things like wound care and management of diabetes and IV feeding or medications, use of like ventilators, respiratory, all of these things that need more resources. So from the provider angle, they're glad because they'll be paid, they'll be compensated for this, so then they can do that. So what we're going to see, and it's happened for quite a while, is higher acuity being taken care of. And this is what the government wants as well. That whole acuity slide, what was in the hospital 20 years ago is now in a nursing home, what was in a nursing home goes to assisted living. That's going to continue. But this isn't, this really is a positive because now the providers will be more open to taking, more complex patients. And this gets into other things too, like depression and therapeutic diets and respiratory therapy, as I mentioned. So there are really 5 different reimbursement case mix groups that build into the code for, the overall pay. So you have physical therapy and occupational therapy is one, speech language pathology is another one. Nursing, if you can believe it, now has its own, and non-therapy ancillary, a lot of medication, whatnot, and then the room and board. Whereas before therapy used to be the King Kong in there. So this is why they're interested in the the complexities that are involved there. And there are CMS statisticians keeping an eye on this, as we said. And with these non-therapy ancillary areas, you get points for what you take. Now, just for example here, there are big charts and everything, but if you have an HIV/AIDS patient, for example, you get 8 points, and more is better. Whereas if you have a wound infection code, it's perhaps 2. There are a whole bunch of things with 1s, but a lung transplant status, you're getting 3. If you have somebody end-stage liver disease, that's only 1. Cystic fibrosis is 1. So this is where this has all been scored out. What takes more resources, that will reward. But this, I think, brings the provider then more willing and able, frankly, to serve these people. And that's what's really needed out there. So I really can emphasize that things are being watched, as far as everybody knows, very closely. And, we'll talk about that later.
And I think so consumers hearing this, they're hearing like ICD-10 codes and MDS, and they don't understand all this language. I think they don't realize that when a parent goes into a nursing home, all of these things that you're talking about are done by the nursing homes, and they're getting points for things. How can family members become more aware of how all of this works?
Well, as always, and as I mentioned a little bit in one of our break, I'm a consumer now too. My mother is in the system, as we might say, with some assisted living help and independent living help. As always, you need to be present. You need to ask things of where, you're getting services. You need to be discussing with the directors and the managers there, what can I be doing? What should I do? Because keep in mind, this is so heavily regulated. I come from a full news reporting background, that it's so heavily regulated that providers are bound to do certain things each step of the way. And so it never hurts to be present, but they still have this code, no pun intended, following them. Okay. PDPM doesn't change an improvement standard. I've seen that mentioned, that there has to be improvement. There was a case called, the Jimmo case, which you may very well have reported on previously, that, no longer says that improvement has to be shown to be getting services. So that's a little bit different. The key is CMS expects beneficiaries to know their policies when they go in, and there are many resources CMS has on its Medicare website. So, ask at each location and understand any special requirements or limitations of the coverage you have. Be present is really, one of the things I can say. And also, as I may have mentioned, they're not out to necessarily take one over on anybody because they have obligations. Rest assured on that.
I think consumers could benefit a lot from learning more about McKnight's, your business magazine, your long-term care, your assisted living. Tell the listeners about the goal of the magazine, share your website, talk about how consumers can become more educated about this by checking you out.
Sure. As a B2B, a professional magazine, we are to help those who run, own, operate nursing homes. And then we have a fully second division, as you mentioned. We have McKnight's Long-Term Care News, which is skilled nursing homes, some of the retirement communities. But then our other one is McKnight Senior Living, which covers assisted living, which, as you know, is much less regulated or regulated at the state level, should I say, and much more with private pay and other things like that. So we have McKnights.com for the skilled side and McKnightsSeniorLiving.com. Each of those has a magazine. Each of those has daily newsletters. We just have 3-4 news items and then other high items of the day. Very highly educational. If you go to either of those websites and look on the right, you can elect to receive those as daily news. They come in the morning like your morning newspaper. My staff, everything is staff written. It's not from wires or anything like that. And we bring it into the perspective of, hey, is there going to be a Medicare payment change? Well, that means something different for the people providing the services than perhaps for grandma. It doesn't mean they're opposite or anything like that. Okay. So it's a great way to educate, and, we welcome anybody who would like to learn more about the industry. Otherwise, of course, I'm sure you've spoken about ombudsman to get the consumer education on different things like that. But McKnights.com and McKnightsSeniorLiving.com are the two places to look.
Great. Jim, thank you so much for joining us. We are going to continue with more examples of nursing home neglect after this break so that you can become a proactive advocate for your older adults in nursing homes. I'm Pamela D. Wilson, your host. You're listening to The Caring Generation live on the BBM Global Network, Channel 100 and TuneIn Radio. Stay with me. We'll be right back.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. transform your rage into right action, release your guilt, position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously with no effort on your part. Join Dr. Janet every Monday at noon Eastern on Dancing with Words, Dancing with Wisdom on the BBM Global Network as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Renaissance woman, trailblazer, maverick. Those are just some of the words to describe Tashandra Poulard, owner and CEO of House of Virgo Entertainment, LLC, a woman minority veteran-owned entertainment company based in Washington, D.C. Ms. Poulard served 10 years honorably in the United States Navy and departed from active duty to pursue her dreams of becoming an entertainment mogul. House of Virgo Entertainment offers script writing, producing, directing, DJ services, editing, and more. They cater to businesses, corporations, college students, working professionals, aspiring artists, and nonprofit organizations, and employ veterans of the armed forces. Tashandra Poulard is pioneering the way we view media and taking her brand global. Visit her at www.houseofvirgoentertainment.com or call 281-515-3740 and like her on Facebook at House of Virgo Entertainment, LLC.
This is Pamela D. Wilson, caregiving expert. I'm your host. You're listening to the Caring Generation radio program for caregivers and aging adults, coming to you live from the BBM Global Network, Channel 100, and TuneIn Radio. We're back to talk about the 4 types of nursing home neglect and the importance of advocating for elders in nursing homes. The first type of neglect is neglect. Neglect in nursing home happens in a couple of areas. Medical neglect, which means poor or inadequate care that results in health conditions getting worse. A worsening condition might mean an infection, like a urinary tract infection, or the health of your elderly parent getting worse instead of better. A skin wound or a bed sore might also be identified. Part of advocating for elders in nursing homes is learning to identify and report these concerns. My personal experience advocating for my clients in nursing homes is that the staff is too busy to notice small changes. You know your family member better than the staff in the nursing home. When you notice unusual behaviors or changes, you have to report them to management in order to advocate for your elder in that nursing home. The second type of nursing home neglect is a neglect of basic needs. Examples are food and water, a clean room, a clean bathroom, things like clean sheets on the bed. It also includes helping to feed an elderly parent who can't feed him or herself. I have arrived many times to see my clients and find them sitting with a full plate of cold food in front of them, not touched because they couldn't feed themselves. This happens more when elderly parents don't feel well or they have cognitive issues like dementia or Alzheimer's disease. I've also arrived and found my clients dehydrated. If you're a caregiver for an elderly parent, you know this. Parents don't always eat or drink like they should, especially if they're not encouraged. Other basic needs include general cleanliness. When you walk in the door or down the hall of a nursing home, are there odors? Does it smell like urine? Report this to the staff. Don't ignore these concerns because if neglect or abuse is happening to your elderly parent, it's probably happening to others who may not have family members to visit. Noticing gaps in these basic needs is part of advocating for elderly in nursing homes. The third type of nursing home neglect is neglect of personal hygiene. Good hygiene is a major issue in advocating for elderly in nursing homes. Be attentive to your elder's teeth. Are they brushed? Is their hair brushed? Are they sitting in soiled clothing if they are incontinent? Many elders need help with personal care. Nursing homes without enough staff will rush through hygiene tasks or skip the assistance if, when they ask your elderly parent if they want care, your parent says no, or they say, oh, come back later, which we know always doesn't happen. What about clean clothing and laundry being done and clothes not being lost? If you haven't learned this yet, things that you take to a nursing home get lost. Make sure that you mark everything, including labeling clothing, shoes, socks, personal items. If your elderly parent wears dentures, have the dentist mark them. The same for eyeglasses and hearing aids. Dentures, eyeglasses, and hearing aids are lost all the time in nursing homes. And the nursing home, they will take zero responsibility for the loss. Half the time, they're accidentally thrown into the trash with a Kleenex. When your elderly parent arrives, there is usually an inventory form in the admission packet. My suggestion, write everything down. Even go to the extent of creating a typed spreadsheet. Make the list as detailed as possible. For example, a green short-sleeved shirt with polka dots. Watch the staff member check the items in, or you'll honestly leave with half of the things that you brought. And never bring anything you don't care to lose. This includes jewelry, earrings, things like that. The likelihood of lost items in nursing homes, it is so high. A very detailed list is part of advocating for elderly in nursing homes. More on the subject of advocating for elderly nursing homes, let's take a moment to talk about the nursing home agreement. Some of these are 40 pages or more if you've ever looked at them. Don't sign it without reading it. And if you are not the power of attorney or the conservator, make sure your elderly person signs that document. Otherwise, you can become the financially responsible party. The nursing home will go after you for payment. If you are the power of attorney or a conservator, sign this way. You sign your name, and then after your name, you write these words, without any financial or personal responsibility. This helps the nursing home coming after you for payment. Also, every agreement has an arbitration agreement. Do not sign it. You don't have to sign it by law. Cross out the pages with a big X, and on the signature line, write the word declined. By law, a nursing home can't require you to sign that agreement as a requirement of admission. Arbitration can happen later if your elderly parent is injured. Read the entire agreement so that you understand all of the rules and the regulations. There are so many. The goal is to avoid surprises and you saying, oh my gosh, no one told me that. All of those little details are usually in the paperwork. Ask questions about anything that you don't understand. Express to the staff immediately about concerns, lost items. Document everything. Document who you talked to, when you reported the concern, so that they can't say, you never told us about that. The nursing home staff will also cite patients' rights for the reason that they leave your parent in bed all day in soiled clothing. Social or emotional neglect and abuse, it links to the interactions with nursing home staff. So research confirms that CNAs will actually report on each other, which is a good thing. But sometimes these issues happen when residents are difficult. Elderly parents can have a bad day. Staff isn't always well trained to react to these situations. It's important to show up, to have conversations, to be aware of everything that's happening so that you can avoid elder abuse for your parents. After this break, we will continue our conversation about advocating for elderly parents in nursing homes, how to avoid abuse and neglect. You can take the Caring Generation with you wherever you go: Apple Podcasts, Google Podcasts, Pandora, iHeartRadio, Spotify, Spreaker, Stitcher, and CastBox. This is Pamela D. Wilson, caregiving expert. I am your host. You're listening to the Caring Generation live on the BBM Global Network, Channel 100 and TuneIn Radio. Check out my website. It is PamelaDWilson.com. There is helpful information there for caregivers and aging adults. Stay with me. We'll be right back.
The opiate epidemic has reached crisis levels, and with so many families affected by addiction, opiate-related drug overdoses, and death, the time is now to have a real constructive conversation about addiction that could lead to better prevention, treatment, and recovery. Alan Charles, author and keynote speaker on drug abuse and prevention, presents The Alan Charles Show. Alan brings a message of hope, sharing his unbelievable story of surviving a 24-year addiction to cocaine, and highlights from his memoir, Walking Out the Other Side, an addict's journey from loneliness to life. His raw honesty and courageous heart breaks the stigma of addiction and offers a unique perspective into the mind of an addict. Join Alan each week as he brings his listeners to a true understanding of the grip of addiction. It is only with this understanding that we can begin to heal. The Alan Charles Show, Thursdays at 9 p.m. Eastern on the BBM Global Network.
For over 50 years, Evelyn Stapula has been a loving advocate for people with disabilities throughout the state of Pennsylvania. President and founder of Big Heart Bridges, her organization actively campaigns for legislation and support of civil liberties that meet the needs of disabled individuals with housing, transportation, and employment. Ms. Stapula has joined forces with a variety of esteemed organizations that advocate for the disabled. She serves on the board of the United Cerebral Palsy of Pittsburgh and the Governor's Cabinet and Advisory Committee for People with Disabilities, and she is a consultant for the Pennsylvania Governor's Conference for Women. Her many efforts have led to the implementation of a transportation program for the disabled with the Access Paratransit System of Allegheny County. Evelyn Stapula strives daily to serve the interests of the disabled, to protect their freedoms, and enable them to live normal public lifestyles. To learn more, please call 412-491-2605 or email Evelyn at ers92645@verizon.net.
This is Pamela D. Wilson, caregiving expert. This is The Caring Generation, coming to you live from the BBM Global Network, Channel 100, and TuneIn Radio. Let's continue with advocating for elders in nursing homes. What can you as a family member do to make sure your elderly parent avoids nursing home abuse and neglect? Other actions for advocating for elders in nursing homes include believing your elderly parent and being observant of what goes on in the nursing home, regularly calling and visiting, initiating contact and meetings with nursing home staff, and being attentive to signs of neglect or abuse. Let's talk about believing your elderly parent. This is important because you may hear something that sounds absolutely, positively crazy that turns out to be true. Maybe your mom reported that staff was yelling at her or her roommate. Mom may report that her medications weren't given on time, that no one took her to breakfast, they forgot her in the bathroom. Listen and investigate these concerns as they may relate to elder abuse and neglect. Get to know all of the staff by name on the wing where your elderly parent resides. Most of the staff will wear name tags. You would be surprised at the things that the staff will tell you that they probably should not when you take a personal interest in them and talk about the care of your mom or dad. Let's talk for a moment about care conferences, which nursing homes sometimes forget to tell families about. That is until about 1 hour before the care conference, when it's impossible for you to show up. Rather than waiting for them to tell you about a care conference, it's important that you ask. What is a care conference? It's a meeting with all of the staff involved in the care of your parent. Attending a care conference by telephone or in person is part of advocating for elders in nursing homes. Staff will review your mom or dad's chart. They'll talk about all aspects of care. It's essential to request that care conference right after an elder is admitted so that there's a plan for discharge. Jim Berklan talked about this earlier, saying that it's important for nursing homes to get these plans done so that they know what the care of your parent will be. Discharge is another one of those subjects that is rarely mentioned to you as the family member until the last minute, and then you're scrambling trying to figure out what to do about mom or dad's care when they leave the nursing home. So back to the care conference subject, questions that you want to ask. How long will insurance pay? Meaning, how long might mom or dad be here in the nursing home? What are the health concerns identified and how will these be resolved? What about physical and occupational therapy? Really important one. How much notice will I receive before mom or dad has to leave? Leaving means being discharged. By law, the nursing home has to give you 3 days notice, but you know what? They may tell your elderly parent who forgets to tell you. Then you're scrambling at the last minute. Even more important, ask what if mom or dad can't care for her or himself upon discharge and returning home? What then? Your goal with this whole nursing home issue is to be able to avoid surprises and stay in control of the process rather than have it controlling you. Advocating for elders in nursing homes means being proactive. In addition to getting to know the staff, ask to talk to the doctor who sees your elderly parent. Ask about medications being given. Nursing homes are great about changing medications without telling you. You might notice a significant change in the health of your parent, and you don't know what happened. It could be a change in medication. Also, know that the nursing homes are very hesitant to send your elderly parent back to the hospital if this is how the nursing home stay started, meaning your parent was in the hospital and then went to the nursing home. Hospitals are financially penalized for patients who come back. So the nursing homes don't want to do that because then they have a bad relationship with the hospital. You can find more about this in an article on my website. Search for the words Rehospitalization Act. If your elderly parent is the subject of elder abuse or neglect, you want to contact the administrator or the executive director of the nursing home to make a complaint, a written complaint. Second, contact the County Department of Health. How do you find them? It's easy. You Google County Department of Health complaints, and a website should come up with a process for issuing a formal complaint that you can enter online. You can also call a phone number. Also contact the long-term care ombudsman or adult protective services. I know you're hearing this and the first thing you're thinking of is, oh my gosh, if we complain, will the nursing home treat my elderly parent worse? No, not if you complain in the right manner. You go to the executive director, you explain your concern, let them know that you're making a report to the county so that it can be investigated. Being upfront and honest is more likely that your concerns will receive attention, your parent will get better care. When I was a nursing home advocate for my clients, I did this as a regular part of my routine. The reality is that, unfortunately, nursing homes are understaffed, which is the main cause of nursing home neglect and abuse, and it's the reason that advocating can be so difficult for elderly parents. But you want to be upfront, be honest. Just work with the nursing homes. They have staffing problems. We know about it. They have difficulty finding qualified staff. The work is difficult. Can you imagine working in a nursing home? The staff is not trained, and when caregivers don't receive that type of training, that's when all of these abuse and neglect issues occur. Ask when you go, how long have the managers worked in that community? Staff retention is one sign of a really good nursing home. Nursing homes that have higher turnover really aren't taking care of or training their staff. It's a sign of poor management. And call the ombudsman. They should be able to tell you whether they recommend that nursing home or not. Next week, our subject is how to talk to loved ones with memory loss. Very difficult subject for some family members. Helpful information for caregivers and aging adults is on my website at PamelaDWilson.com. There you will find my caregiving library of articles, videos, my blog, online courses, and podcasts from the Caring Generation radio show going all the way back. I'm Pamela D. Wilson, your host. You are listening to the Caring Generation live from the BBM Global Network, Channel 100, and TuneIn Radio. Check out my website, PamelaDWilson.com. Also, if you are a working caregiver, make sure to talk to your company about caregiving programs in the workplace. I offer a variety of programs for corporations to help working caregivers manage through all of the caregiving issues that we talk about on these radio shows. And the radio shows do address all of the emails that I receive, so you can always contact me through my website or through my Facebook page. My website, again, is PamelaDWilson.com. Hit the contact button and send me an email. Stay with me. We'll be right back after this break.
French Rastafarian baker Chef McKnight is a fourth-generation baker and has worked in 11 countries across 3 continents. Born in Mulhouse, France, he began apprenticing in his father's bakery at age 12 and has devoted his life to learning cultures of the world from inside kitchens across the globe. He also teaches traditional French baking by hosting demonstrations and classes, and his passion for baking is reflected in his delicious confections. With a deep respect for discipline and his Rastafarian way of life, Chef McKnight exemplifies commitment to tradition and culture in a global world. Traveling extensively and combining a myriad of flavors into his recipes, Chef McKnight brings a unique approach to baking. To read more about the French Rastafarian baker, visit www.frenchchefhugues.com. That's Hugues. Bon appetit and bless up.
Introducing BetterHomeAndGarden.com. That's www.betterhomeandgarden.com with just the letter N in Better Home and Garden. BetterHomeAndGarden.com offers you the highest quality products on the market that are environmentally safe and effective, and to make them available to you at the lowest possible prices. BetterHomeAndGarden.com understands that kind of creativity and do-it-yourself attitude. Thus, we developed our website, BetterHomeAndGarden.com. BetterHomeAndGarden.com offers you the following products right online: bath, bedding, collectibles, craft, sewing and hobby, food and beverage, furniture, home decor, kitchen and dining, lamps and lighting, large appliances, musical instruments, outdoor cooking, patio items, pet supplies, plant and garden, rug and floor covering, small appliances, travel and luggage, and so much more. Better Home and Garden is an online retailer offering a wide variety of high-quality brand-name merchandise at discount prices. Our service is personal and we aim to please. Visit us at www.betterhomeandgarden.com. Make your home your own.
Have you ever felt like no one is listening, or you're not getting the honest attention you deserve? Do you even know the kind of attention you want or need? You are not alone. Alice Aspin March is here to help. Thanks to Alice, through her epiphany and research over the word attention, there are solutions to the attention dilemma. Worldwide audiences have been enthralled and engaged for over 40 years with her visionary and pioneering observations. The kind of attention we get and give is vital to improving our lives and society. Alice and her weekly guests review game-changing insights for transforming and improving our understanding of attention, providing techniques for creating healthier and empowering behavior. Get a new perspective on a mainstream word. Tune into Why Our Attention Matters for fresh and thought-provoking conversations every Tuesday at 3 p.m. Eastern on boldbravemedia.com and the TuneIn Radio app.
This is Pamela D. Wilson, caregiving expert. I'm your host. This is the Caring Generation radio program for caregivers and aging adults, live on the BBM Global Network, Channel 100, and TuneIn Radio. I want to talk about the other side of nursing home elder abuse and neglect in respect to the hard-working staff and the CNAs. The other side is resident concerns. Resident concerns include physical or verbal aggression by residents who are your parents, inappropriate sexual behavior, and residents who have mental illness and other disorders. What you may not realize is that the activities, behaviors, and participation of elderly parents in hospitals and nursing homes is all documented. For example, let's say that your father was at a nursing home, he refused to participate in care, or there was an issue where he might have harmed a staff member. After this nursing home stay, he goes home. Then he has another accident. He's in the hospital, and you want him to go back to the same nursing home, but they refuse him. Do you wonder why? It's because of concerns that were documented about your father's behavior. Maybe you were involved in your father's care, and you were documented as being unhelpful. This stays with you for a long time, this documentation. There's also a pre-admission and a screening tool called a PASSR. It's spelled PASSR. It's a federal requirement that nursing homes have to evaluate people who have mental illness, intellectual or developmental disabilities, to make sure that they're not taking too many people that they can't care for. So like Jim talked about earlier, nursing homes want to make sure that they can provide care for people coming in. This pre-admission and screening tool helps with that. As you can hear from all of this, advocating for elders in nursing homes, it's very complex because of everything that's involved. Nursing homes have very strict regulations for residents' rights, physician and nursing services, behavioral health, their pharmacy, food and nutrition, and so many other areas. If you're curious, you can Google CMS Medicare and Medicaid programs, requirements for long-term care facilities. There's a document there. It's about 100 pages long that you can read if you like. The challenges in advocating for elderly in nursing homes is that consumers, you're unaware of all these rules and regulations because they're not really explained. Simple language is in those nursing home admission packets, but other information usually doesn't come up until there are problems. So the more educated you are, the fewer problems that will show up. As Jim and I talked, the best that you can do as a family member is to continually ask questions and be educated. Find out about making appointments with nursing home staff to talk to them, communicate with the doctor on staff, be friendly, know everybody who is helping your parent. Know that you can also hire income companions to sit with your elderly parent if you can't be there. You can hire a care manager. Sometimes this does require telling the nursing home that you are doing this. So if you want to hire extra help, just talk to the nursing home management. It's so important. The care that you provide to your elderly parents and spouses, it is so important. It is so needed. Without you, things would happen in nursing homes that would be unfortunate and could cause harm to your elderly parents. I thank you all listeners for being so proactive and interested in caregiving, health, and well-being. Please do share the Caring Generation with your family members and your workplace so that we can make caregiving something we talk about. Podcasts of all the shows are on my website at PamelaDWilson.com. Thank you for joining me on the Caring Generation radio program for caregivers. I'm Pamela D. Wilson, caregiving expert, advocate, and speaker. I look forward to being with you again next Wednesday evening. God bless you all. Sleep well tonight and have a fabulous day tomorrow and a great week until we are together again.
Tune in each week for the Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.